Before we turn to the panelists and get their views on things, I just want to take a moment of context, because there really is a lot going on in cancer. There's a lot going on in hematology. You just have to go down the street to the convention center and to hear about what I think we really could call a revolution in cancer care and cancer treatment at this point. The whole issue of genomics, of personalized care, of hundreds and hundreds of diagnoses and subdiagnoses, and the more and more individualized and personalized medicine gets, the better the future looks, but in some ways the more complicated it gets. So that's one part of what I think is really a major change. We also are talking all the time about big data. We talk about this in our personal lives, and we talk about it certainly in the oncology community and hematology community as well. What is this aggregate of all this data we have going to do for people who are patients, and what's it going to do for the research and clinical community? We're also in a time of tremendous change on what is often called payment reform. But that really means, how are we going to pay for cancer care? What, are we going to pay for episode of care? Are we going to pay in bundling? Are we going to look at what value is, our subject today? Are we going to look at what we call patient-centric measures? Payment is changing rapidly, mostly with models of change now, but many of which I think are going to become reality. And the last area, and one that's very gratifying to me because I've been talking about it for decades, is really the issue of patient engagement. We really are paying attention to the patient, and we're actually starting to measure these patient-centric measures. What does the patient think of the outcomes? How much have they participated? What has been asked of them? How have they been assessed? So these are four things that are really very, very important, and they all do inform this subject of value. What does it really mean to be treated? What's it worth? What is it worth to society? What is it worth to the individual? So I just want to give you a couple of definitions of value, because I bet if I went around the room, every one of you would come up with something a little different about what it means to have value in medical care. So the first definition, and one that's very, very popularly used, is Warren Buffett's definition, and that's price is what you pay, value is what you get. And I can tell you, I went out for dinner last night and had a good dinner that actually wasn't that expensive. It was moderately priced, and it was really good. So I really got value from that. But it's easier for me to talk about that with what I paid for dinner last night than what I would be paying for my medical care. There are two people at Harvard Business School, Michael Porter and Elizabeth Iceberg, who have written a lot about value and are frequently referenced anytime you talk about value. And they say that value is really outcomes relative to cost, but they say the creation of value for the patient determines the rewards for all others. So they put the patient at the center of this, that's really where the value comes from. The Affordable Care Act mentions the word value more than 200 times, but never defines it. I didn't go through all 200 references, but I went through a lot of them, and it's never specifically defined. And the last definition that I want to give you is one that comes from NICE, from the UK. We talk a lot about how the UK decides which medicines are appropriate. And they say that value is based on scientific value judgments, fine, including clinical and economic evaluation and social value judgment, including efficiency and effectiveness. So those are different kinds of words than we often use in this country, and we hear a lot about what the system is like in the UK. So those are really three definitions, plus the lack of definition in the ACA, that gets us started on this discussion about value. So I want to turn to our panelists and ask them what they think of value and how they would define it.
It's very peculiar in healthcare because often you don't know what the response is going to be, and you don't have a good idea what the costs are going to be until after the fact. And so I like to phrase it as, after it's happened, do you have remorse for the consequences? So whether that be financial costs, toxicity costs, or other things, I think healthcare is very unique in that sense. And defining value really has to sit in your core, whether you feel like it was worth it after the fact.
When you ask that question to patients, it's what's important to them. And many things are important to patients. Cure, having quality of life becomes very important. And I also think that we have to think about where people are in their lives. What are their priorities? Maybe a young adult, for them, it's, the values, are they going to be able to have children or not? For someone who already has children, for example, are they going to be able to launch them? Are they going to be able to see them get married? These are people who are living, right? They want to, the value is what's important to them. And then maybe someone who's older wants to make sure that they have a legacy to give to someone. And so what the trade-offs are there. Is an expensive treatment worth it for me, or would I rather leave something for my family? So I think we have to think about value, and we really have to take into consideration sort of individual differences and what's important to the people.
If I said to you, if we spend 0.5% of our healthcare dollar on cancer care and we got back in return 52 million life years worth $5 trillion. That is what measures the bar mitzvahs we are able to see, the graduations we're able to attend, the weddings we're able to pay for, like me. I would say that's a good bargain. And that measures the collective value of innovations over the time. Just one other fact. There was a drug developed 40 years ago which showed no survival benefit. It was the most expensive drug on the market of its time. According to NICE, it would not have been used because there was no survival benefit. That drug was AZT. Most people on AZT lived more than 0, and they were able to live long enough to get retroviral therapy. And that's the progression that cancer patients are now being faced with. 2 more months may not seem a lot to an economist, it means a lot to me, but it's a lifetime for many people in this room. And we have to make sure that our healthcare system rewards that kind of investment and doesn't expose patients to a high out-of-pocket cost of a treatment that not only saves the insurance industry money, but saves lives as well.
I've had the opportunity to engage with a number of lymphoma and CLL patients about this issue. Talking to them about the national dialogue and the debate, and they really don't care about that. They care about themselves. They care about extending their own lives. They care about what happens to their family. And so for the most part, what they've told me is they care about the right treatment for the right patient at the right time. And at the end of the day, that's what value means to them.
Leukemia and Lymphoma Society exists to find cures and to ensure access. And we consider value to be all of the benefits measured against all of the costs. So costs really are part of the value, but so are the benefits. And when I mean all of the benefits, some of it has already been said, but the benefits in terms of medical and clinical outcomes, the benefits in terms of patients' own preferences, aspirations, goals, what a patient needs, as well as the benefits to society at large and what are to the entire healthcare ecosystem over the costs. And the costs, again, all of the costs. Price is one of those, medical costs, hospital costs, again, costs to the entire ecosystem. That's how we look at value. I do want to acknowledge and remember Selma Schimmel, who was such a driving force for Vital Options and who really had an incredible impact on empowering and educating patients.